Can you go? Thanks. Good morning, members of the public. Today is Wednesday, March 27th, 11:10 a.m. This is the Committee on Health and Homelessness in room 329 and on Zoom. For anyone who's available on Zoom, please stay muted. Use the chat only to talk to our technical staff, and if for some reason we lose connection and aren't able to continue the hearing, we will adjourn and renotice. We have two resolutions that we're taking up on this agenda, and we will be taking up the HCRs and HRs in tandem. So first we have HCR 132 and HR 113, urging the counties to adopt an ordinance requiring restaurants and other food service establishments to take steps to make their businesses safe for members of the public with severe food allergies. Members, we received testimony in support for these resolutions from about 8 individuals. If any of them are here in the room or on Zoom and would like to testify. No one on Zoom. Okay. Seeing none, is there anyone else in the room who'd like to testify? Please.
Thank you, Vice Chair. Aloha Committee. Angela Melody Young testifying on behalf of CARES. So this proposal is more of an appropriate proposal for the State of Hawaii's Department of Health to implement a food allergy alert flyer, and this responsibility also should be more of a consumer responsibility than a restaurant's responsibility, right? So when you go into a restaurant, you should be aware of your allergies, and it is due diligence of the public to ask. It's not the responsibility of the restaurant to cater to you. I went through the DOH safety food handler certification class. So it's just an insight, one perspective. And so we know when a policy is created, it shouldn't be burdensome for restaurants. Businesses have to go through a series of DOH safety parameters for an establishment to operate. DOH has the food safety branch. So if you were to create such a policy, the more appropriate one is the State of Hawaii Department of Health food safety branch to implement it. Because the food safety education program is a program to make sure operators of those selling food to the public for consumption are aware of when food expires and like where to put things in the freezer. So the food safety education program was launched in 1989 with the primary purpose of protecting the public from foodborne illnesses through education and training. The instructors, food sanitarians with extensive field experience provide real-world insight and the students include chefs, cooks, dietitians, managers, staff from the pantry, stewards, and waiters. And so the class is something taught to the public for free, and it is designed to provide the restaurant operators and food handlers with a basic understanding of food microbiology, major foodborne illnesses, and learn how to implement specific procedures to make sure safe food is prepared properly. And the class also provides an excellent review for those already certified. And certification is valid for 3 years after the class. So again, this is not from my perspective, a county's responsibility. It's more appropriate for the Department of Health, the food safety branch. Thank you.
Okay, thank you. Anybody else in the room wishing to testify? Anybody on Zoom? Seeing none, members will be moving on. Oh, members, questions? Seeing none, moving on to the next set of resolutions, HCR 141 and HR 123, resolving to end homelessness on Maui. We received testimony from the Department of Human Services.
Good morning, Chair, Vice Chair, committee members. Joseph Campos, Deputy Director, Department of Human Services, here on behalf of Director Kathy Betts. The department is in support of this measure, or this resolution. We just wanted to point out that the Department of Human Services is taking the lead on the governor's initiative of Kalai'ola, building 450 temporary units to help house the displaced from the wildfires. And that actually has already started construction work. They put up the dust fence today, or in the process of putting up the dust fence. Rock crushing will begin on April 1st. So we are on schedule, and, we hope to be able to provide the services necessary for the people that have been displaced. In addition, we just want to encourage that there is support for the governor's budget, which increases monies both for the Department of Human Services as well as the State Office on Homelessness and Housing Solutions to ensure that we can provide affordable housing for people. Thank you.
Thank you. We also have testimony in support from Maui Council Chair Alice Lee. And testimony in support from 3 individuals and 1 individual in opposition. If any of them would like to testify, either here in the room or on Zoom. Seeing none, anybody else in the room wishing to testify?
Aloha, committee. Angela Melody Young, testifying on behalf of Kapalama Neighborhood Security Watch. We, as a neighborhood security watch, get trained by the community policing team from the Honolulu Police Department. Regarding homelessness, in the emergency declaration from last year, it's declared as a humanitarian crisis.
Could you please make sure, so this resolution is specifically about Maui. If we
Yeah.
could keep your remarks confined to that.
If the state is trying to resolve homelessness in Maui, and the methods and strategies can be applied to Maui with the methods and strategies that are used here also, right? So across the state, if you're creating homeless policies, right, for Maui and all the other islands, right, but specifically for this resolution for Maui, we should be aware that the methods and strategies to be implemented should not be derived of the concept that homelessness is a humanitarian crisis, which is what was declared at the emergency declaration for all of the state of Hawaii level, right? So for Maui, then, right, the focus should really be, and it should be reflective of the island that we're at now, and where we're at with this county is that they're trying to implement medical health, behavioral health solutions, right? So it should get copied to the solutions in Maui as well, because it is effective. So again, the focus for Maui, right, should not be addressing homelessness as a humanitarian crisis, because homelessness is a medical emergency. It is a public safety crisis. To protect the health and safety and the security of the community in Maui. Thank you.
Thank you. Anybody else in the room or on Zoom wishing to testify? Not members, questions?
I have a quick question. Yeah.
Gosh, I'm getting asked a question. Thank you.
Well, actually, you didn't. Could you state your name for the record, please? I didn't catch that.
Angela Melody Young from Kapalama Neighborhood Security Watch.
Thank you, Angela. Are you in opposition or support?
Wishing to comment.
Oh, okay. That was my only question.
Oh, okay.
Thank you.
You
Any
can
other
also
questions,
ask me
members?
for any resources.
Okay, seeing none, we'll go right into decision-making. Okay, sorry. Okay. So again, we'll be taking up voting and decision-making for the HCRs and HRs in tandem. So again, first up, HCR 132 and HR 113, urging the counties to adopt an ordinance requiring restaurants and other food service establishments to take steps to make their businesses safe for members of the public with severe food allergies. We are going to pass this out with amendments. Just on page 2, we're going to update the Be it resolved clause outlining the requests for what should be included. We're going to keep number 1 for the poster for staff. The second point on line 17, page 2, instead of in the menu, we're going to just require restaurants to post signage that people should inform their servers about food allergies, and we are going to strike number 3, making all the lists for every dish available, making all the ingredients used available to the public. Someone should have pointed that out in testimony, yeah. And any technical non-substantive amendments that we might find. Members, any questions, comments, or concerns? Seeing none, Chair for the vote.
Chair's recommendation is to pass with amendments. Chair, Vice Chair voting aye. Representative Amato.
Aye.
Representative Ilagan.
Aye.
Representative Kobayashi excused. Representative Martin. Aye. Representative Nishimoto excused. Representative Garcia.
Aye.
Chair, your recommendation passes for HCR 132 and HR 113.
Thank you. Members, moving on to HCR 141, HR 123, resolving to end homelessness on Maui. I received some technical non-substantive amendments from the introducer just to clean up some of the language. So we're going to be just taking those changes, but otherwise passing with amendments just for those cleaning up some of the mostly typos to just pass out a clean document. Any questions, comments, or concerns? Seeing none, Chair for the vote.
Chair's recommendation is to pass HCR 141 and HR 123 with amendments, noting the excused absences of Representatives Kobayashi and Nishimoto. Any reservations? Any noes? Chair, your recommendation passes.
Thank you, members. Adjourned. And Fiona.
Commencing our 11:15 a.m. decision-making agenda, members. This is resolutions we took up last hearing, so I'm going to just go through our votes. So first up on, good. Okay, we're going to take up HCR 125, HR 106. This is our telehealth amendment. Chair's recommendation is to pass out HD1 that amends the composition of the working group so that the Director of Health or his designee shall serve as co-chairperson of the working group. A representative from the Healthcare Association of Hawaii shall serve as co-chairperson of the working group. Allowing the licensing administrator of the professional and vocational licensing division to identify the representative from that division, adding Hawaii Health Information Exchange as one of the representatives, and requiring, not making it permissive, but requiring that following members be invited by the co-chairs: 2 representatives from healthcare systems operating in the state, and 3, not 2, but 3 representatives from health insurers, mutual benefit societies, or health maintenance organizations operating in the state. The final be it further resolved clause will have the appropriate entities and their representatives identified as to who the copies of this concurrent resolution should go to, and any technical amendments identified by staff. Members, any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on HCR 125, HR 106, Chair's recommendation is passed with amendments. Chair and Vice Chair vote aye. Representative Amato?
Aye.
Representative Ilagan?
Aye.
Representative Kobayashi is excused. Representative Martin? Aye. Representative Nishimoto is excused. Representative Garcia?
Aye.
Chair recommendation is adopted.
Thank you. HCR 182, HR 162, members, this is our resolution having to do with prior authorizations. Pursuant to the auditor's recommendations, we're going to allow changes from the auditor to the Legislative Reference Bureau, and instead of a comprehensive analysis, it's going to be requesting the Legislative Reference Bureau to conduct a study of statutes and regulations related to prior authorization requirements and the timely delivery of healthcare services in the state. I'm going to change throughout references from the auditor to the Legislative Reference Bureau, as well as clean up the language as to what the study will be focusing on. And mostly the study will focus on a summary and analysis of current state and federal statutes and regulations governing prior authorizations in the state across all health insurance plans in the state, and a comparison of Hawaii statutes and regulations governing prior authorization to the statutes and regulations of at least 5 other states, identified through the input and feedback from stakeholders, including patient advocates, providers, and payers. Members, this is going to kind of focus the study more. So it's not necessarily a consideration of claims data or anything like that, but more a study of what is the landscape, the legal landscape of the statutes and regulations around the country. And then modifying some of the kind of specific areas that we want them to look at through the lenses of statutes and regulations. Members, comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on HCR 182, HR 162, Chair's recommendations passed with amendments, noting the excused absences of Reps. Nishimoto and Kobayashi. Any reservations or noes? Seeing none, Chair, recommendations adopted.
Members, last resolution, HCR 186, HR 166. This relates to the 340B drug programs. Chair's recommendation is going to take basically the amendments of HPCA, which focuses this resolution on urging the governor, the Department of Human Services, and the Department of Health to explore this policy area, and adding in federally qualified health centers throughout, and making the appropriate changes as to who this resolution will be certified and sent to. Again, the thing is, the main focus is to make sure that it's the governor, the Department of Human Services, and the Department of Health that takes action on this recommendation. Okay, members, questions, comments, or concerns? Seeing none, Vice Chair for the vote.
Voting on HCR 186, HR 166, recommendations passed with amendments, noting Reps. Kobayashi and Nishimoto excused. Any reservations or noes? Hearing none, Chair, recommendations adopted.
Members, I think this may be our last Committee of Health and Homelessness meeting, barring any other need to have any other hearings. There might be needs for informational briefings, I will say that. But I don't believe, there might be Senate resolutions. That might be the one thing that brings us back and pulls us back. But barring that, thank you all for the great and hard work done in this committee. We've accomplished a lot, and we have still much more to do as we head into the final month and few days of the legislative session. Members, any comments, questions, concerns?
Just want to say thank you, Chair, for running a tight committee. And you do really good work on these bills, so thank you for your research and your knowledge and the dedication you bring to the table. Thank you.
I think it's a collective effort, and I know that the bills get better because we all weigh in, and as well as the public. But mahalo, and we are adjourned.